Have you ever wondered how shockwave therapy could potentially change your life? In recent years, this innovative treatment has been making waves in the medical community, no pun intended. Its popularity is on the rise, and for good reason. Shockwave therapy has shown promising results in treating a variety of health conditions, and the potential applications for this therapy continue to broaden as research advances. Now, you might ask, what exactly is shockwave therapy? Well, in a nutshell, it's a non-invasive treatment that uses pressure waves to stimulate the body's own healing process. It's like giving your body a little nudge to kickstart the healing mechanism. It's a fascinating blend of science and nature, and it's been making headlines for one application in particular, the treatment of erectile dysfunction. Yes, you heard it right. Erectile dysfunction, a condition that affects millions of men worldwide, is one of the many health issues that shockwave therapy can help address. This application has been a game changer, offering hope and a potential solution to individuals who may have found little success with traditional treatments. But that's not all. The scope of shockwave therapy extends beyond erectile dysfunction. From musculoskeletal conditions to heart disease, and even certain skin conditions, shockwave therapy is proving to be a versatile tool in the medical arsenal. It's a testament to the advancements in modern medicine, and the possibilities it presents are truly intriguing. But, like any medical treatment, it's not a one-size-fits-all solution. Each application has its own set of considerations, and the effectiveness can vary from person to person. So, are you ready to explore this exciting frontier in healthcare? Whether you're a medical professional looking to expand your knowledge or a curious individual interested in the latest health trends, we're here to guide you on this journey. We'll delve into the science behind shockwave therapy, discuss its applications, and weigh the benefits against the risks. So buckle up because it's going to be an enlightening ride. Let's dive deeper into the intriguing world of shockwave therapy. So what exactly is shockwave therapy and how does it work? Imagine hearing the word shockwave, and you might instantly think of a powerful, explosive force. But when it comes to shockwave therapy, the concept is far from destructive. Instead, it's a revolutionary treatment that uses the power of sound to stimulate healing in the body. Shockwave therapy, also known as extracorporeal shockwave therapy, is a non-invasive treatment that delivers acoustic waves to specific areas of the body. These acoustic waves, or shock waves, are not electrical shocks, as one might initially think. Instead, they are mechanical pressure waves that transfer energy to the body's tissues. The therapy works by generating a sequence of low-energy acoustic wave pulses, which are then directed onto the treatment area through a probe or applicator. As these waves pass through the tissues, they stimulate a process called neovascularization. This is the formation of new blood vessels, which enhances blood flow to the treated area. But the magic doesn't stop there. These waves also stimulate the release of certain growth factors, which are proteins that help cells to grow and divide. This increases the rate of tissue regeneration, leading to faster healing and recovery. One of the most well-known applications of shockwave therapy is in the treatment of kidney stones. This process, known as lithotripsy, uses high-energy shock waves to break down the stones into small pieces that can then be naturally passed out of the body. But breaking down kidney stones isn't the only thing shockwave therapy is good at. It's also used to improve blood flow, particularly in cases of poor circulation. By stimulating the growth of new blood vessels, shockwave therapy can help to increase the supply of oxygen and nutrients to tissues, promoting overall health and well-being. Now, you might be wondering, how exactly does it feel to undergo shockwave therapy? Well, most people describe the sensation as a series of intense pulses or shocks. However, the intensity of these shocks can be adjusted to ensure the patient's comfort during the procedure. And while some minor discomfort may be felt during the treatment, this typically subsides quickly once the session is over. In essence, shockwave therapy is a fascinating blend of science and technology, harnessing the power of sound to stimulate healing in the body. It's a testament to our ever-evolving understanding of the human body and our ability to develop innovative treatments that can help to improve our health and quality of life. Now that we understand how it works, let's explore its various applications. One of the most groundbreaking applications of shockwave therapy is in the treatment of erectile dysfunction. But how does it work? Well, let's break it down. Shockwave therapy, often referred to as low-intensity extracorporeal shockwave therapy, or simply LIESWT, is a non-invasive procedure that uses acoustic waves to stimulate and encourage the growth of new blood vessels. Now, what does this have to do with erectile dysfunction? Quite a lot, actually. Erectile dysfunction, or ED, is often caused by poor blood flow to the penis. This can be due to a variety of factors such as age, certain medical conditions like diabetes or cardiovascular disease, and even lifestyle choices. The result is the same: difficulty in achieving or maintaining an erection. Enter shockwave therapy. By promoting the growth of new blood vessels, shockwave therapy essentially paves new pathways for blood to flow into the penis. This improved blood flow can significantly enhance erectile function, making it easier for those suffering from ED to achieve and maintain an erection. But the benefits of shockwave therapy for ED don't just stop there. This treatment method also stimulates the release of growth factors, which can lead to tissue regeneration. This means that not only can shockwave therapy help to improve blood flow, but it can also contribute to the overall health and integrity of penile tissue. Imagine a garden that's been suffering from a lack of water. The plants are wilting, the soil is dry. Now imagine a gardener comes along and not only waters the garden, but also tills the soil, plants new seeds, and nurtures the garden back to health. That's essentially what shockwave therapy does for the penis in the context of erectile dysfunction. So, while it might sound a bit futuristic or even a little intimidating, shockwave therapy is quite simple at its core. It's all about promoting blood flow and encouraging new growth, both of which are key to combating erectile dysfunction. A promising solution to a problem that affects many men worldwide, isn't it? Moving on, another remarkable application of shockwave therapy that deserves our attention is in the treatment of kidney stones. So, what are kidney stones? Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. They can be incredibly painful to pass, and in some cases may even require surgery. However, thanks to the advancements in medical technology, there's an effective and less invasive treatment method available: shockwave therapy, otherwise known as extracorporeal shockwave lithotripsy, or ESWL. But how does ESWL work to treat kidney stones, you might ask? Well, ESWL uses focused sound waves to break up kidney stones into tiny pieces. These pieces are small enough to be passed naturally in the urine, thus relieving the patient from the painful process of passing a larger stone. This procedure is non-invasive, meaning no incisions are made. It's usually performed under sedation or light anesthesia, ensuring the patient's comfort throughout the process. It's important to note that while ESWL is highly effective, it may not be suitable for everyone. Factors such as the size, location, and type of kidney stone, as well as the patient's overall health, are taken into consideration before opting for this treatment. As you can see, shockwave therapy is not only transforming the way we treat conditions like erectile dysfunction and heart disease, but it's also providing a non-invasive solution to painful problems like kidney stones. Truly, the potential of shockwave therapy in revolutionizing healthcare is immense, and we're only just scratching the surface. Stay tuned as we delve into more applications of this innovative therapy in the next section. But the applications of shockwave therapy don't stop at erectile dysfunction. This innovative treatment method has been making waves in various fields of medicine, from cardiology to orthopedics and pain management. Let's delve into these other applications of shockwave therapy and see how they're changing lives. In the world of cardiology, shockwave therapy has shown promise in the treatment of heart disease. It's been used to stimulate the growth of new blood vessels in the heart, a process known as angiogenesis. This has proven beneficial for patients suffering from ischemic heart diseases, where there's a reduced blood supply to the heart muscle. The shock waves trigger the release of growth factors, encouraging the formation of new blood vessels and ultimately improving blood supply and heart function. Now let's move on to orthopedics, another field that's embraced shockwave therapy. It's been effectively used to treat a variety of joint and tendon issues, including tennis elbow, plantar fasciitis, and calcific tendinitis. The shock waves work by promoting the body's natural healing process. They stimulate the production of collagen, a protein that's vital for repairing damaged tissues. Additionally, they help to break down calcium deposits that can cause pain and inflammation in conditions like calcific tendinitis. Chronic pain is a pervasive issue that affects millions of people worldwide. It can be debilitating, affecting a person's quality of life and mental health. But there's a glimmer of hope. Shockwave therapy, often used as a last resort when other treatments have failed, has been found to be effective in managing certain types of chronic pain. It's commonly used to treat conditions like chronic pelvic pain syndrome and complex regional pain syndrome. The therapy works by disrupting pain signals sent to the brain, providing relief to patients. It also encourages the release of substances known as endorphins, the body's natural painkillers. There's also ongoing research into the use of shockwave therapy for wound healing, and even in the cosmetic industry for cellulite reduction. The therapy is believed to stimulate the production of elastin and collagen, which can improve skin texture and elasticity. These are just a few examples of how shockwave therapy is being utilized in medicine. It's important to note that the therapy isn't a magic bullet that can cure all ailments. It's a tool, and like all tools, it's most effective when used appropriately, in conjunction with other treatments and lifestyle changes. The beauty of shockwave therapy lies in its versatility. It's non-invasive, which means that it doesn't require surgery or drugs. This makes it a viable option for patients who are unable or unwilling to undergo more invasive procedures. And while it's not without its risks, as we'll discuss in the next section, its potential benefits are undeniable. So, as you can see, the potential uses for shockwave therapy are vast and varied. This is a field of medicine that is continually evolving, and as we learn more about the body and how it responds to treatment, the list of conditions that can be treated with shockwave therapy is likely to grow. Like any medical procedure, shockwave therapy comes with its own set of benefits and risks. Let's kick things off with the benefits. One of the most appealing aspects of shockwave therapy is its non-invasive nature. It's a treatment that doesn't require any incisions or injections. This means no lengthy recovery times or hospital stays. You can usually go about your day right after a session. Another significant benefit is the potential for long-lasting relief. Shockwave therapy works by encouraging your body's natural healing processes. It stimulates blood flow and helps regenerate damaged tissue. This approach can provide a more permanent solution to chronic pain in many cases, rather than just masking the symptoms. In addition to pain relief, shockwave therapy has shown promise in several other areas. It's been used to treat conditions like kidney stones, heart disease, and even certain types of erectile dysfunction. The versatility of this treatment method is truly impressive, but it's not all sunshine and rainbows. Now let's switch gears and talk about the potential risks and side effects of shockwave therapy. While generally considered safe, some patients may experience mild discomfort during treatment. The intensity of the shockwaves can cause a bit of a sting. However, this sensation is typically brief and manageable. In some cases, patients may also experience minor side effects after treatment. These can include bruising, swelling, or numbness in the treated area. It's important to note that these side effects are usually temporary and should subside within a few days. In rare cases, there might be more serious side effects or complications. However, these are typically associated with improper use of the equipment or treatment of certain conditions without proper consultation. That's why it's crucial to undergo this therapy under the supervision of a qualified healthcare professional. Remember, every individual is unique. What works for one person might not work for another. It's important to weigh these factors before deciding if shockwave therapy is right for you. So, we've covered a lot of ground today about shockwave therapy. In our journey, we've delved into the fascinating world of shockwave therapy, a medical treatment that uses powerful but short energy waves to heal various conditions. It's an intriguing concept, isn't it? This therapy isn't just a science fiction concept, it's a reality that's helping countless individuals around the world. We explored the science behind this treatment, understanding how these shockwaves work at a cellular level. They stimulate the body's natural healing process by encouraging the growth of new blood vessels and improving blood flow. It's a non-invasive treatment that literally shakes things up at the cellular level, prompting the body to heal itself. We also discussed the application of shockwave therapy in treating erectile dysfunction. This is where the therapy truly shines, providing hope for many who have struggled with traditional treatments. By improving blood flow in the penile area, shockwave therapy can potentially restore natural erectile function without the need for medication or surgery. It's a game changer, offering a new lease of life for those affected by this condition. But the wonders of shockwave therapy don't stop there. We discovered its other applications in treating various diseases. From kidney stones to heart disease and even certain orthopedic conditions, shockwave therapy is proving to be a versatile treatment option. It's like a Swiss Army knife in the medical world, capable of tackling a wide range of issues with its unique approach. And of course, we cannot forget our discussion on the benefits and risks of shockwave therapy. Like any medical treatment, it's a balance. On the one hand, it offers a non-invasive, drug-free alternative with promising results. On the other hand, it's not without potential side effects, including mild pain or discomfort during treatment. But overall, the potential upsides seem to outweigh the downsides for many people. So, there you have it, the world of shockwave therapy in a nutshell. It's a fascinating field, one that combines cutting-edge technology with our body's natural healing capabilities. It's a testament to the wonders of medical science and a beacon of hope for those struggling with certain health conditions. But, as we always say, knowledge is power. The more informed you are about your treatment options, the better decisions you can make about your health. And that's what we hope to achieve with these discussions. Remember, always consult with a healthcare professional before deciding on any treatment. Thanks for tuning in, and we hope you've learned something new about the fascinating world of shockwave therapy.